When I started the program, I was a practicing pediatrician and had a public health degree, but was really interested in social determinants of health, but didn't exactly know where I was going with that. And as a result of the program, I ended up pursuing the academic route, but my relationships I developed and the network I developed through the program helped me start my work with the Federal Reserve Bank system, which led to my new project, which is the Build Healthy Places Network. Our mission is to support and catalyze work at the intersection of community development and health. So this is nonprofit community development that invests in low-income communities, trying to make them better, safer places to live. Minneapolis, Dallas, Cleveland, San Francisco. But we also are now really actively creating a website that is going to support people looking into doing this kind of work. So there's a whole network of people in this community development sector, this nonprofit sector, that are investing in neighborhoods, but they often don't know anybody in the health sector. They also don't know one another in many cases, so we're really the connector. So the community development sector has about $200 billion a year that they invest in low-income communities. And my experience is that people in public health and medicine don't know anything about them at all. And they have not traditionally measured health as an outcome of their work. So the way we've framed it is that they're leaving a return on investment unmeasured. And that really gets their attention because they see value in that. So what we'd like to do is basically nudge that $200 billion a year into work that's more closely aligned with the upstream social determinants that we're all interested in. One of the organizations I work with is called Purpose-Built Communities. It's based in Atlanta, Georgia. I started out working with a neighborhood called Eastlake, which is one of the most notorious neighborhoods in Atlanta. It was called Little Vietnam, not because there was a Vietnamese population, but because it was a war zone. And over the last 15-ish years, they have transformed it into a mixed income, so middle class and low income families. They redid all the housing in the neighborhood. They changed the schools and the employment has gone up. Crime rate has plummeted. The kids are doing really well. And this organization, Purpose-Built Communities, is now working with 12 sites across the country now. And they did not consider health as one of their interests until we got a chance to talk to them and they saw that everything they do has health implications for the children and families. I'd say that the population health focus changed my research much more dramatically towards the social determinants of health and away from my medical background. And so I really now believe, as a physician, that the most critical long-term factor for health is education. So completely outside of my medical background. So children being educated, especially through high school, just are going to have the opportunity to live much longer, healthier lives. And so that is sometimes difficult for me to share with my medical colleagues who are focused on treating illness, which is very, very important. But in order to keep kids out of the hospital long-term or out of the clinic long-term, you need to be well educated.